Welcome to this year's REACH Mentorship Program. We want to thank you so much for participating and congratulations. This orientation aims to do the following. We will identify and list the roles and responsibilities of an effective mentee. We will also list the expectations, the benefits of the REACH Mentorship Program. In October, you will have your first meeting with your mentor. They will be reaching out to you to talk about other times and dates to meet that are convenient for both. In the spring, we will eventually have a banquet honoring you as a mentee and the mentor. That will be done in Sioux Falls at a later date. And finally, in May, we will ask for feedback and surveys as how you thought the mentorship went. This next slide will list possible topics that you and your mentor can discuss. Again, nothing is set in stone, and anything that you think is relevant to your learning about different healthcare careers, you can certainly add to this list. This is only something to guide you as a mentee and the mentor as you meet from month to month. Formal mentoring usually takes place in a work or educational setting. Someone is either assigned or sought out to help another one, quote unquote, learn the ropes. You should be aware of the things you will need to do to be more effective in the formal peer mentoring situation. Here are some aspects of an effective mentee. You should have an eagerness to learn. We are glad that you have signed up for this program and hope your eagerness to learn continues throughout the mentorship. Your willingness and ability to work together. You have questions and concerns. Our mentor should be able to help you answer those. However, be willing to take advice with a grain of salt. Make the most of the time you have. You have a limited amount of time to work with these students. The quality of time is so much more important than the quantity. Don't be afraid to ask for help. If you're having difficulty knowing what topics to discuss, ask your peers what they might ask a med student. Demonstrates effective behavior. Be on time. Showing up early is better. If something occurs or something comes up, make sure to communicate with your mentee or mentor early and often. Also listen intently and be open-minded. Don't be quick to judge. Although you have been matched with a number of similar aspects with your mentor, you may disagree on some topics or beliefs. It's okay to have a differing opinion. Be respectful and courteous. This next slide discusses a list on how to balance your responsibilities as a mentee. Number one, you should be aware. Learn as much as you can about yourself and about how you deal with challenges and opportunities. Also, know what you want. What do you want to gain from this experience? Number three, you should set goals. Continue to focus on long-term and short-term goals. Determine your self-efficacy, the power or capacity to produce a desired effect. And number four, plan consistently. Determine how you will approach the next meeting with your mentor and get it on your calendar. Be optimistic. Assess your attitude. Some days you just won't be quote unquote feeling it. Do your best to lay negativity aside when meeting with your mentor. And then number six, reflect often. Objectively reflect on accomplishments and setbacks. Evaluate both the process and the result. Keep a journal. Here are some benefits we hope you get as a mentee. We hope to enlighten your next steps. You will learn a lot about the process and logistics of applying to college, entrance into different programs, and beyond. We also hope that you'll improve communication and listening skills. Everyone, even professionals, need help in becoming active listeners and better communicators. And this experience will help you do that. And finally, we hope that you make some really good connections. As the saying goes, sometimes it's not what you know, but who you know. We hope that this experience forms a professional relationship that will last. Most of the skills gained through the mentorship program will be transferable. This means you'll be able to use what you have developed in a future in academia and/or a career in medicine or other healthcare field, especially communicating with your patients. Focus on being an active listener. You should learn some valuable experiences to take with you into an interview. For any other questions or inquiries during the mentorship process, please feel free to reach out to Brock Rops, South Dakota Host's Executive Director, at 605-357-1576. Or you may email him at brock.rops@usd.edu. At the end of the day, successful mentees will become independent and confident in their abilities. You must be able to list all of the benefits you hope to gain from the experience. However, this experience isn't all about you. There must be a balance between a self-focused mentee and an other-focused mentee. Success comes when mentees strike a balance between their mentor's needs and their own needs. Med students are busy folks, but they've taken the time to be a mentor, and that says something. As a mentee, you should work together with your mentor to establish meeting times and dates, along with topics to discuss. Please feel free to deviate from those if you and your mentor so desire. Prior to starting your mentoring at the end of October, you will be asked to complete a short 9-question anonymous survey. Following the mentorship program, you will also be asked to fill out a short anonymous post-survey. Only you know why you've committed to being part of this program. Give your best effort to create a mentoring relationship that will benefit all involved. Have a great experience.